Each one of the providers does a talk once a year, and it's geared towards patients, and we try to come up with topics that we think would be beneficial to help the patients that we see every day. And so I try to come up with something that I think I see a lot, and maybe people have a lot of questions or kind of frustrated about or would like maybe some help. And fatigue is one of the things that I see a lot in our practice. There's a lot of different causes and a lot of different reasons for fatigue, and we'll go into that a little bit. The treatments are based on the problem. So it can be difficult. It can be a process by which you have to go through in order to be able to find the cause of fatigue. But it can be a very, very frustrating thing, not only for the patient, but also the practitioner, because a lot of times if you can't find a specific answer, there's not a lot of great solutions to it either. So we'll kind of talk about a little bit of all of that. There we go. So the first thing I wanted to talk about is just the definition of fatigue. It is a feeling of weariness, tiredness, or lack of energy or motivation. It's not just being sleepy, and it's not just, feeling a little bit tired. It's more than that. It's overwhelming exhaustion. It may or may not be relieved or improved with rest. One of the key things is that if it's not improved with rest, then there might be some underlying problems that you need to deal with. It is disruptive, and it interferes with all aspects of your daily living, and it's different than drowsiness or the need to sleep. There we go. So fatigue can be a normal and an important response to physical exertion. If you overdo it, you do a little bit too much, you're going to be tired that day, and that might be a normal response. Emotional stress. Stress is really huge. The way that your chemicals in the brain relate to anxiety and stress can add to fatigue as well. Boredom. If you're simply bored, you can be fatigued. It just you don't have a lot to do, a lot to think about, so it can cause fatigue. Lack of sleep, and we'll talk about a little bit later on some different things that we can do to try to help improve our sleep. And then it may be a more serious psychological or physical disorder. Chronic fatigue syndrome, which we'll talk about in a little bit, is something that occurs over time, and you have to have fatigue for greater than 6 months, which is a really long time. Something that's considered chronic is usually greater than 6 weeks in duration. So if it's lasted longer than a month and a half, it's considered chronic fatigue. It diminishes energy and mental capacity, so you have difficulty thinking and concentrating. It impacts your emotional and your psychological well-being. When you're all tired, it's hard to be able to think clearly, to be able to do the things that you want to do. You're less able to tolerate stress and tolerate all those things that are going on in your life if you're fatigued. And it may be symptoms of an underlying medical problem which require medical treatment. And we'll talk about that. Oops. So there's over 10 million doctor visits annually attributed to fatigue alone. More women than men, especially in my experience. I see a lot of fibromyalgia patients and a lot of people with chronic pain issues, and I see more women than men, but it is more common in women. And it can be associated with other diseases, or it can be a primary syndrome, which is chronic fatigue syndrome, and we'll talk about that in a little while. So when should you go to your doctor and seek medical attention? If it's not relieved by enough sleep, if you sleep and you feel like you're getting adequate sleep and good sleep and you're still fatigued all the time, then maybe it's time to see your doctor. If it's not relieved with good nutrition, if you've been eating poorly and drinking alcohol and haven't really paid attention to your diet and you kind of change that around, you need to try to be a little bit healthier about the things that you're eating and what you're doing, and it really hasn't helped, it might be time to see your doctor. If it's not relieved when stress is controlled. I have a lot of fibromyalgia patients in my practice that I see, and the people I see that have the most pain and the most fatigue are people that have a really chaotic life. They don't control their environment very well. They have a lot of social anxiety, a lot of anxiety in their life, and I think that really contributes to and leads to a lot more fatigue and a lot more pain. But stress is absolutely huge, so it's important to try to, when you have that conversation, because I'll sit and have conversations with my patients about their home life and how much stress they have, and are they taking time for themselves and doing something to get away? Are they getting a massage? Are they working out and taking care of themselves? Those things are really important if you want to feel as good as you possibly can and reduce fatigue. And then if fatigue is chronic, extreme, or prolonged, you want to seek medical help as well. It is a common symptom, and it's not usually due to a serious illness, although it can be. And it does have a greater effect on the quality of life than pain, which I think is really interesting. I think pain, you can take some pain medications and it does improve and you can still do the things that you want to do, but fatigue is hard when there's no specific treatment for that fatigue, and it just goes on and on and on, and there's nothing that you can do. So I think it takes a bigger toll on people. So lifestyle factors that can contribute to fatigue include alcohol use or abuse. You think if you drink too much, you're going to get a really good night's sleep, and unfortunately that's not the case. And we'll talk about that a little bit. Caffeine use, not enough caffeine use, or actually over caffeine use. If you drink too much caffeine, it can make you tired. Excessive physical activity. If you work out too much, you don't take time to allow your body to recover and to rest, you can have fatigue. But inactivity and physical deconditioning is a huge part of fatigue, in my opinion. Lack of sleep, and then a lot of medications can cause fatigue, and this is just a few of them. Antihistamines such as Benadryl, we take that because it helps us sleep, but it makes us tired, and that can cause fatigue. Cold medications, prescription pain medications, narcotics especially, one of the biggest side effects is sedation and causing fatigue. It makes you feel like you're just wiped out. A lot of heart medications and blood pressure medications, beta blockers, for example, those medicines that end in LOL that you take for your blood pressure, those medicines commonly can cause fatigue. It's a very common symptom. And then antidepressants as well. Sometimes you kind of have to work through that initial period where you don't feel quite right and you're more fatigued, but after a period of time, usually antidepressants will help and eventually will improve your fatigue. And then unhealthy eating habits. If you eat a lot of carbohydrates, a diet that's high in breads and pastas and high in fats and stuff, you're not going to feel as good. You're going to feel sluggish. You're not going to have as much energy. If you eat good foods that are good for you, eat your 4 to 5 servings of vegetables and fruits every day, eat low-fat dairy products, and you avoid the foods that are high in simple sugars and stuff, you're going to feel a lot better. So it's important to kind of look at all of that stuff if you're feeling like you're just kind of pooped out, and try to find some causes that you're doing that might be contributing to it. Psychological problems, I thought this was a great little card too. Psychological problems include anxiety, depression, grief, and stress, and we've talked about that a little bit. You know, if you're really stressed out, it's going to cause you to use up some of those energy units. Dr. Valente describes fibromyalgia. When people get fatigued, he says you only have so many energy units a day. And when you use them off, they're gone, and then that's it. And people sometimes overdo, and then they literally can't do anything for 2 or 3 days after they do something because they've just used up all of those energy units. So it's important to kind of know where you're at and how much energy you have, and to use it wisely over time and to rebuild energy as you need it. So that will help as well. And then it's important to address these issues. Why you have anxiety, there's certain medications that we can use to help that. Once again, having that conversation with patients about why they have stress in their life and what's going on and how they can best deal with it. If they're depressed, getting them on medications to deal with that. Counseling, talking to somebody about those kind of issues. And you know, when you have grief, you have a loss or something like that, it just wears you out mentally, you know, and then of course fatigue kind of follows along with that. So there's lots of different medical conditions that can cause fatigue, and we're going to go over some of these specifically because they're a little more common. Liver problems, if you have irritation of your liver, you have hepatitis, or you have some type of liver disease, or you have a medication that's affecting your liver, and you have an inflammation of your liver, it can make you feel tired. We can usually determine this by blood tests. It's fairly easy to see this, and then we use additional tests to try to figure out what's going on, like ultrasound or CAT scans of your abdomen and your liver, that kind of thing. But that is frequently can frequently cause fatigue. Anemia is another big one, and we're going to talk about that separately. Cancer, having cancer itself can cause you to be fatigued, and then of course the treatments for cancer, radiation therapy especially, and chemotherapy can cause you to be fatigued. Chronic fatigue syndrome, we'll talk about that in just a little bit. Chronic kidney failure. This is when the kidneys are actually not functioning to the ability that they can, and a patient has to usually have dialysis in order to be able to do the work of the kidneys. I used to have a girlfriend who had diabetes, and she had kidney failure, and she ended up on dialysis. And the day before she'd go in for dialysis, and she did it like every 3 days, like 3 days a week, I think, she was so tired that she could barely get into the car. But by the time she got dialyzed and she came back home, she felt better. But when your kidneys don't work, all of those toxins build up in your body. You can't get rid of them, and it just really wipes you out. Anything that takes energy, anything that takes away from your body being able to function the way that it should every single day is going to make you fatigued. COPD and emphysema, if you have a harder time breathing, a harder time oxygenating your body, you're going to feel fatigue. Heart disease, lots of different kinds of heart disease can cause fatigue, whether it's an arrhythmia like atrial fibrillation, where the heart, the top of the heart fibrillates. You lose about 25% of your cardiac output, or the amount of blood that's pumped out of your heart kind of sits in your heart. And you lose all of that oxygen that circulates to the body, so it can cause fatigue. If you're having ischemia, meaning you're not getting adequate oxygen to the heart muscle, that can cause fatigue as well. A lot of people present to the emergency room or to their doctor complaining of severe fatigue, and they've had a heart attack and they never really knew it. Congestive heart failure, where your heart doesn't pump as well as it should and fluid kind of backs up and your heart isn't pumping the needed oxygen and stuff to the body, can cause fatigue. Hyper and hypothyroidism, both of those can cause fatigue. We'll talk about that a little bit. Obesity, we're also going to talk about. That one's huge. Restless leg syndrome, I think this contributes to it just because people don't sleep really well at night. They don't get quality sleep because they're moving back and forth all the time and they're constantly in a restless state, so they don't get restorative sleep at night. Sleep apnea, one of the hallmarks of sleep apnea is daytime drowsiness or fatigue during the day. And that can be diagnosed by a sleep study, and people have to wear like a positive airway pressure mask at night, and usually their fatigue improves considerably. Diabetes, if your blood sugar is low or if it's high. If your blood sugar is not well controlled, it can definitely cause fatigue. And then inflammatory conditions, we'll talk about this just a little bit. This is kind of what I deal with in my office. Rheumatoid arthritis, inflammatory arthritis related to connective tissue diseases and lupus and things like that. And then chronic pain, the fact that you have pain itself takes a lot of energy to deal with the issues of pain. You don't feel well on a daily basis. A lot of the medications that we use to treat chronic pain can also contribute to the fatigue, so it's kind of a big cycle. And fibromyalgia we'll talk about separately, just a little bit. So when you go to see the doctor, you're fatigued and you really feel like something's going on. You've tried to do some of the things that you can do at home and you're taking care of yourself and you're doing everything right, but you decide, I think something is not quite right. I need to go see my doctor. Initially, they're going to do blood work. We can find a lot of stuff out from doing blood work. They can do a simple blood count. We can find out if you're anemic. We can find out if you have an infection, possibly a lymphoma or some type of cancer. We can find out if your bone marrow is producing cells the way that they should. We do chemistry studies where we look at your liver function studies and your kidney function studies, and that'll tell us if those organs are functioning adequately or not. And in rheumatology, we always do a SED rate and a CRP, and any of you who have some type of inflammatory arthritis know what that is because we check it every time you come in. They're inflammation tests that we check. A SED rate is called an erythrocyte sedimentation rate, and erythrocytes are red blood cells, and they put them in a tube and they wait to see how long it takes them to clump and fall to the bottom of the tube, and they count it. The longer it takes, the more inflammation is present in the blood. A CRP is a blood test that looks at a protein produced by the liver, and if it's elevated, it can indicate some type of inflammation, but there's a lot of other things that can cause that. Any type of inflammation in your body, and an infection, cancer, anything going on. You just had surgery, a lot of times those blood tests will be up. So they're very non-specific markers of inflammation, but something that we can use to maybe help lead us in the right direction to try to figure out why you're fatigued. X-rays, they kind of just rule out other things, rule out fractures, rule out tumors, rule out something else going on that may be contributing to it. History of present symptoms. When you come into the doctor's office, we always ask you, so what have you been doing since the last time we saw you? How's everything going? Are you taking your medications okay? How long has this been, if you have fatigue, how long has it been going on? Are there contributing factors? Is there anything that makes it better for you? We ask you all those questions because that helps us to try to determine what the cause might be. And then we have you guys fill out a review of symptoms, which is a form, and you get to circle all of those little things that maybe you have a problem with. And that will also help us to kind of determine what might be causing the issues. Past medical history, so what's been going on previously in your past. Do you have a history of some type of inflammatory disease? Do you have rheumatoid arthritis in your family? Do you have a history of heart disease? All of that kind of stuff will help us. And then physical exam is extremely important. There are a lot of different causes that we can determine just on physical exam. Do you have enlarged lymph nodes? Does your heart sound right? Does your lungs sound right? Is anything going on in your belly? That kind of stuff. So all of that stuff is really important to help us try to figure this out. And I will tell you that sometimes this is a process. You don't always come up with the answer the first time. As a matter of fact, it probably is something that may take a while to figure out what's going on. Sometimes it's pretty easy to figure out. Sometimes we think maybe medication might be doing it, so we stop it, but it doesn't really help. Then you're back in the doctor's office again, and you have to try to figure it out. So we use all of this stuff to try to help pinpoint where we're at, to try to figure out exactly what's going on. So treatment consists of treating the underlying conditions. So whatever the problem is, we treat that problem, and then the fatigue will improve, or usually improves, I should say. Inflammatory diseases and fatigue. Fatigue is one of the most common symptoms of rheumatoid arthritis. When people come back in and they're flaring and their rheumatoid arthritis is not well controlled, they feel very fatigued. Their body has active inflammation going on, and that inflammation causes the immune system to kind of be revved up, and it takes energy to do that, and it takes away from the energy that you have to do the things that you want to do every day. It is caused from active inflammation. There are these things called cytokines. They're part of the immune system. They're little protein molecules, and those are kind of jacked up when we have active inflammation, and that causes destruction to our joints when we have active rheumatoid arthritis, and that whole process contributes to you feeling fatigued. Patients that have rheumatoid arthritis are frequently anemic, and a lot of times, even if we control the disease, we still see anemia in these patients. It's called a chronic disease state. So anytime you have a chronic disease, you can be anemic as a result. Your bone marrow just doesn't produce as many red blood cells and hemoglobin like it should, just because you have a chronic health state or chronic disease. And there's ways that we can look at the ways the red blood cell looks. We can try to figure that out by some additional blood tests. Lack of sleep due to pain. We have to deal with issues of pain, and we have to deal with inflammation in order to take care of that. And the treatment is to treat the inflammation. It's not to treat anything else, but treat the inflammation, because treating that will help treat the fatigue. Anemia. Does everybody know what anemia is, really? Yeah? The hemoglobin is part of the red blood cell that carries oxygen to the body. So when somebody says you're anemic, it means your hemoglobin is low. In women, it's normally 12 to 16. In men, it's normally 13 to 18. Women get a little bit lower value. But when your hemoglobin's low, you don't have enough oxygen circulating through your body, and frequently you can be fatigued as a result. It usually takes a pretty low hemoglobin for you to really feel pooped out. If a normal is 12 in women, I would say your hemoglobin would be like 8 or 9, and then you might feel fatigued. If it's 11, probably not, but it usually, below 10, you might start to feel fatigued. It is the most common blood condition in the United States. There's over 3.5 million people that have anemia. There are more than 400 types of anemia. It frequently is caused from blood loss. We prescribe a lot of non-steroidal anti-inflammatory drugs like ibuprofen, Aleve, that kind of stuff. Those drugs frequently cause bleeding in the stomach, especially as you get older. The risk is a lot higher to have bleeding. But that is a very common thing. So we see like low iron levels when people have blood loss. As a result, they have anemia. They can have decreased or faulty red blood cells. Maybe the bone marrow is not producing red blood cells adequately. That can cause an anemia. And then destruction of red blood cells. Your spleen normally destroys old red blood cells. They constantly circulate through your body. You make new ones. You get rid of the old ones all the time. There could be a problem with your spleen or some reason why you're destroying red blood cells, and that can cause anemia as well. And once again, the treatment depends on the cause. This is a good illustration of how hemoglobin works. When you take in oxygen through your lungs, it transports across the barrier through these little alveoli, these little air sacs in your lungs, into the bloodstream. So the oxygen transports from the lungs into the bloodstream via hemoglobin. Hemoglobin picks it up, and then it carries it throughout the body. So if you don't have enough oxygen, you don't have enough hemoglobin, frequently you can be fatigued. And this is something we can easily see when we draw a blood count on people. I watched something on Dr. Oz the other day, and he was talking to people about anemia, and he was saying that if you think you're anemic, you can pull down the little bottom part of your eye, and if it's not pink, if it's pale, you might be anemic and you should have it checked. So I thought that was kind of interesting. And he actually found somebody in the audience that had a pale conjunctiva, and told her she needed to get her hemoglobin checked. So. Okay, so hyper and hypothyroidism. This is a little hard to understand, but there's a hormone called the thyroid stimulating hormone that's produced by the pituitary gland in your brain. And that hormone tells the thyroid to produce more hormones, or it will prevent the thyroid gland from producing hormones if you have adequate hormones in your body. If your thyroid stimulating hormone is high, it means you have hypothyroidism or low thyroid, because the pituitary says, hey, I'm not producing enough thyroid, I need to stimulate the thyroid. So your TSH, or the thyroid stimulating hormone, will be high, but your thyroid hormones will be low. Does that make sense? So we can do a simple TSH. This is a really common thing that we do, especially in women. Your gynecologist probably does this every time you go in for your annual exam and stuff. So it's something simple that you can do. So if your TSH is high, it suggests that you have hypothyroidism or an underactive thyroid. The most common symptom is usually fatigue. People also have cold sensitivity. They get constipated. Things just kind of slow down. Your metabolism isn't revved up enough. You have weight gain. They can have brittle fingernails and brittle hair. Their hair falls out and gets really dry. It can also cause depression, and the treatment for hypothyroidism is providing a thyroid supplement, or Synthroid or levothyroxine, something like that. Hyperthyroidism, on the other hand, is an overactive thyroid. Your TSH will be low because that stimulating hormone doesn't need to be high, doesn't need to stimulate that thyroid to produce more thyroid hormone. The most common example of hyperthyroidism is called Graves' disease. Once again, it can cause fatigue. A goiter is an enlarged thyroid, so a lot of times you can see it. You definitely can palpate it. If you get behind somebody and you feel it, you can actually palpate sometimes nodules in the thyroid gland, but it'll usually be enlarged. Most of the time you can't feel people's thyroid. They will have heat intolerance instead of cold sensitivity. They'll have an increased appetite, but then they actually lose weight. I wish I would get this just for a little bit of time, just so I can lose like 10 or 15 pounds. And it can cause restlessness because you're kind of hyped up. And then the treatment for hyperthyroidism is radioactive iodine or surgery to remove your thyroid. And then if you have your thyroid removed, then you're going to be on thyroid supplement for the rest of your life. It's a very common cause of fatigue, so we check this frequently. Even though I don't deal with it and I don't treat it, we check it a lot of times, and we send the results over to the primary care doctor so that they can manage it. Obesity. This is a very, very, very difficult subject to talk to people about. The government, Medicare, actually has us counsel people on weight management if their BMI is above 30. Does everybody know what a BMI is? I'm really... what's that?
Body mass index.
It is, body mass index. Yeah, I'm really surprised at how many people, I ask my patients all the time, and they really don't know what it is. It's a simple calculation that looks at your height and your weight, and it determines if you're overweight or not. Medicare says that if your BMI is above 30, we need to counsel you on a weight management program. We suggest that you join some type of program that can help you losing weight, and we encourage you to increase your physical activity. And we actually have to give you a diagnosis of obesity, and we actually have to document it in your chart. And they are actually looking at this. The government is going back and they're looking, Medicare patients are going back and they're looking at whether we document this information or not. When we do vital signs, if your BMI is above 30, it shows up in red in our electronic medical records. And if we don't counsel you and make a diagnosis of obesity, then we get dinged for not doing it. There are calculations on the internet all over. You can go anywhere and type in BMI, and you can put in your information in there, and it will tell you what your BMI is. It's inexpensive. It's easy to use. A normal healthy BMI is 18 to 24. Anything between 25 and 30 is considered overweight, and anything above 30 is considered obese. So it's easy to say this, but being overweight is a result of energy imbalance. You're eating too many calories and not getting enough physical activity. I have people tell me all the time, but I'm busy all day long. I really, I never sit down. I'm busy, busy, busy. I work around the house and I do things all day long. That's great, but it's not exactly the definition of adequate physical activity or exercise, and we'll talk about it here in just a minute, that helps you to get that calorie deficit, to get your weight down if you need to, or maintain a healthy weight. Body weight is also the result of genes, metabolism. Those people that are thin and they can eat anything in the world and they never gain weight, I don't understand that. It just makes me mad. But there are people like that. And I think when they get older, it's probably going to catch up with them, probably. But your metabolism, your behavior, the environment, your culture, the types of foods that you eat because of your culture. People that are Hispanic eat different foods that maybe are higher in fat than maybe, I don't know if they incorporate as many fruits and vegetables and stuff in their diet, but they eat a lot of tortillas and meats and all of that kind of stuff. So it makes it difficult. And socioeconomic status, I think that kind of works both ways. If you're well off, maybe you go out to dinner a lot and you eat a lot of large portions, and you eat a lot of sodium, and maybe you entertain a lot, and so it's always about food, and you're always eating quite a bit. Or maybe you're poor and you don't have access to good food. You can't pay for good fruits and vegetables. You can't pay for the lean meats. You buy the cheaper cuts of meat that are more fatty and stuff. So I think that plays a role in it as well. Behavior and environment play a large role, causing people to be overweight and obese. These are the greatest areas for prevention and treatment actions. So we are always encouraged, and this is according to the U.S. Surgeon General in 2011, to prevent and decrease overweight and obesity in our country. So this is a big push by our government to do this. So if we ask you these questions, don't be what do I want to say?
Offended.
Offended. There you go. Don't be offended. So we have to do that. Hey, I'm going to stop real quick, and I'm going to grab one of these. These are little door prizes. They're little promotional items. And I have number 16. Can you tell me who's number 16 back there? We're going to give away just a couple little door prizes here. And I always forget till the very end, so I better do this now.
Roger.
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 Roger. Roger. Roger, what would you like? A cookbook, a water bottle, or a little arthritis center bag?
Cookbook.
Cookbook? The whole joint's cooking. Arthritis center cooking. You're welcome. I like it. I've never even seen that before. Okay. Hopefully there's good healthy recipes in there, right? Okay, so now let's go on to the next one here. There we go. So you need to have a healthy diet. You need to eat the right amount of fruits and vegetables. You need to eat lean meats. You need to eat whole grains and low-fat dairy products. You will feel better if you eat the right foods. Have you ever gone out and eaten a really heavy meal, a lot of pastas or a real heavy meal, and you get home and you're just absolutely wiped out? That's because it takes so much energy to break all of that stuff down. You have more food than you actually need, and it just takes a lot of energy away from you. So it's important to eat well because you're going to feel better. And it's important to include lean meats, poultry, fish, beans, eggs, nuts. They say that you should eat beef probably twice a week. The rest of the time it should be turkey, chicken, and fish, if you can. Eat low saturated fats, low sodium. That's huge when you go out to dinner. You never can really find a lot of things that are low sodium, but they are coming out with a lot more stuff. So it's important to kind of check that, to read labels and look at that. And then sugars. They have a lot of sugar substitutes today. A lot of things that you can use instead of using sugar that don't taste too bad, so it's something to kind of look into. Comfort foods, those kind of things that you like to eat, you need to eat those kind of things once in a while. If you don't, you're going to be thinking about it, you're going to overeat, you're going to eat too much. So it's important to have comfort foods, but it's important to balance that with eating healthy. And you want to eat less often, eat smaller amounts, perhaps choose a smaller plate, or I've done metabolic research in the past, and you actually have to weigh your food. I have a little scale, and to this day, I still put my plate on there, and I still weigh my food before I eat it to make sure I'm not eating too much. Because it's amazing how you can kind of think that it's not much, and then you look at the portion size, and you realize you're probably eating too much. When you go out to dinner, it's probably 4 portion sizes that you get when you go out. I was talking to a lady the other day, and she said that before she starts eating her meal, she'll get a take-home box, and she'll cut her meal in half, and she'll put half of it in the take-home box, and then she'll sit and eat the rest of her meal, so that way she's not tempted to eat the whole thing. That's a really good idea. I think it helps. And then try lower calorie versions of everything. You know, we have Curtis from Hy-Vee that's, giving you recipes at Hy-Vee and doing all of this stuff to try to promote healthier ways to make the same kind of foods, and there's a lot of ways that you can substitute. Using spray butter instead of real butter on your food, using Mrs. Dash instead of using salt every day, eating low-carb versions of the same things. I think all of those things are really important, and believe it or not, after you kind of change the way that you eat, you really don't miss it that much, and you feel better. You need to increase your physical activity. So to create a calorie deficit, these are the different types of exercise that they want you to engage in. This is the goal from the CDC. You're supposed to have 150 minutes of moderate intensity aerobic activity. Moderate is considered walking briskly, doing yard work, shoveling snow, actively playing with the children, or biking. 150 minutes, that's 30 minutes 5 times a week. That's not bad, that's kind of doable. Or you have to have 75 minutes of vigorous, intense aerobic activity, or you can have a combination of the two. And intense activity is considered jogging, running, swimming laps, which is, in my opinion, a great form of exercise. I love swimming. Cross-country skiing, rollerblading, skating, competitive sports, playing football, basketball, soccer, that kind of stuff. So I have people that tell me all the time, well, I'm active during the day. Or if they say I do yard work, I think that counts. But you need to get your heart rate up for a period of time in order to be able to burn calories. It's not just about shuffling around your house and I cleaned my house today or something. You know, kind of need to work a little sweat up and kind of get going a little bit. That's the kind of thing that you need to be doing on a daily basis. And it's harder, you know, when we get older, especially when we're retired, right? It's hard. Because you don't want to get up and do anything. It's hard, but it's important. Chronic pain also contributes to fatigue a lot, and we deal with a lot of chronic pain, unfortunately, for a lot of different reasons, whether patients have advanced rheumatoid arthritis that have destroyed their joints. Today we have really, really good drugs that can treat rheumatoid arthritis very effectively. There are people that have had it for a long time and had destruction to their joints a long time ago, and as a result they have chronic pain because of it. And we have to deal with those issues. People that have osteoarthritis, that is really severe, and it causes chronic pain. Back pain is one of the biggest things that we see, chronic back pain, which is very difficult to manage. Pain signals are called nociception. So when you get some type of pain out here in the periphery, out wherever it is, you cut your hand or something, that sends a signal to your brain and it says this hurts. And it causes you to do something in response, to pull away, to be able to treat yourself, to know that you need to get help. Pain that is chronic outlives its usefulness. It no longer provides anything useful to you. It just lingers, and it's usually as a result of the fact that it didn't get treated adequately in the first place. We didn't treat it the right way. Chronic pain is also associated with progressive non-malignant diseases like rheumatoid and osteoarthritis, like we talked about. So this is difficult because when you treat chronic pain, unfortunately, a lot of times we use medications that cause a lot of fatigue and cause you to be real drowsy. And we'll talk about those options here in just a little bit. But it's important to control the pain. Stress and pain, the thalamus, which is part of your midbrain in your brain, regulates pain, sleep, and the pituitary adrenal axis, which is part of that thing that causes all those hormones to be released that helps regulate all of these things in our body. So no wonder why, when we're stressed and we have pain, no wonder why we're fatigued, and contributes to, it's kind of a big vicious cycle. Acute stress is a natural physiologic trigger of the intrinsic pain inhibition system. That's a big long word, but basically what that means is that acute stress can contribute to pain initially and can contribute to fatigue. Chronic stress causes low corticosteroid levels, can remodel our brains over time, so our brain thinks differently. They've done MRIs of fibromyalgia patients, and when they create some type of a stimulus to a fibromyalgia patient, their brain reacts differently than the normal population. They respond to pain in a different way. Somehow those pathways of pain have changed the way that that patient responds, and we don't really know what to do about it. It's very difficult to treat, but somehow things change in the body. You become, your body just changes over time, and you feel more pain more of the time, and it's because of the changes in the periphery and changes in the brain as well. So we deal with those issues when we're treating that. So treating chronic pain, like I said, narcotics, frequently we use those, whether they're long-acting narcotics or ones that you use short-term. Ibuprofen, we use that frequently. Tylenol is actually the most recommended drug for people over age 65 for pain. A lot of times it doesn't work really well, but it's the safest drug, and that's the reason why we use it most often. Anti-seizure medications, we'll talk about that with fibromyalgia a little bit, but we use medicines like Lyrica and gabapentin. I don't know if anybody's familiar with those, but one of the side effects of those medications is that it can cause severe fatigue. And then antidepressants also, especially when you first start them, they can make you feel weird and really kind of worn out. But if you kind of stay with them, hopefully over time, about 8 weeks or so into the course of treatment, usually it will improve. Ice and heat. Using ice and heat I think is very beneficial. Using topical analgesics. We have been pushing this a lot more lately, and I think the reason is because it does help with pain relief. There's very few side effects with that medication, and it does give you some relief, and it does help you to feel better almost initially or almost immediately. Acupuncture and chiropractic care. Chiropractors believe in different things than physicians do. They believe that the spine, everything originates in the spine, and then if the spine's out of whack, that you will have pain as a result, or you have fatigue as a result. So if they can just malalign the spine, that you're going to feel better. Acupuncture is based on the premise that there's these invisible life force pathways in the body, and so they place pins in certain points in the body to kind of realign these invisible forces. From a medical standpoint, you think, well, that's kind of crazy, isn't it? That doesn't make a lot of sense. But I think that there is a lot of use in chiropractic and acupuncture for patients that have chronic pain and don't get relief from traditional therapies. And I actually recommend people trying it, especially people that have low back pain and they can't have surgery and they can't, take any more pain medication. Physical therapy, I think, is really important. They teach you strengthening and stretching exercises. They teach you exercises that you can do on a daily basis that help you stay as physically fit and limber and keep your range of motion as possible. And I think it's important to stay with that. We send people to therapy all the time, and then guess what? They stop doing the therapy after they go home, and they don't do it anymore. So they come in and their shoulder hurts, and they're like, well, are you doing those stretches that they taught you when you went to therapy? No, not really. How come? Well, I just don't do them anymore. But it's important to keep doing that kind of stuff. It takes 15 minutes every day to just get up and do some simple stretches, and it's really important. So chronic fatigue syndrome is, and we'll talk about this a little bit, chronic fatigue syndrome is when there's no other cause for your fatigue. When they've done all of these studies and all these tests and they can't figure out why you're tired. It affects more than 1 million Americans, more than multiple sclerosis, lupus, lung cancer, and ovarian cancer. I think that's kind of amazing. It's 4 times more frequently seen in women than in men. It occurs most often in the age 40 and 50, which I think is kind of surprising to me. It is more prevalent in adolescents than in younger children. We don't see it in younger children as much. It occurs in every ethnic and racial group and in every country in the world. It affects all income levels, and it can be seen in families, so they think there might be some type of a possible familial or genetic link, but they don't know what causes it. They don't know why this happens. It is a complex disorder. It is an overwhelming sense of fatigue. It's not relieved by rest. They're just tired all the time. They function at lower levels of activity, so one little thing that they do just completely wipes them out. They have weakness, muscle pain, and this is interesting that they have all these other symptoms. So you think about this. Well, they come in with weakness and fatigue. Well, that could be a lot of things, couldn't it? Muscle pain and fatigue. They can't concentrate or think. That could be a lot of things. They can't sleep at night. And then they have post-exertional fatigue lasting more than 24 hours. So that means if they actually do something, then they can't do anything again for like a day or two. They just literally are completely wiped out and they can't even function. That's very common in fibromyalgia patients as well. People that have severe fibromyalgia, they will tell you that if they exercise or work out, then for 2 days they just don't go anywhere or do anything. They can't even go to the grocery store to shop or to do anything. It's just so debilitating. So the causes are not identified. They think possibly it might be caused from some type of infectious agent. It might be some type of dysfunction of your immune system. It could be something wrong with your hormones. It could be this neuro-mediated hypotension, which means you get low blood pressure as a result of your nerves. Your nervous system causes low blood pressure. They do these things called tilt tables, where they have you lay down and then they raise you up, and if your blood pressure drops, then that might be related to this neuro-mediated hypotension. They find people that have chronic fatigue syndrome frequently have hypotension when they do this test. So they don't know what really the relationship is between those. And then they looked at different nutritional deficiencies, but so far they haven't really been able to prove that in any way. There are no specific diagnostic tests to say that you have chronic fatigue syndrome. It is an exclusion of all other diseases. So basically you have to work a patient up and you have to make sure that nothing else is wrong. You can't find an answer. They have all these other symptoms, and so you diagnose them with chronic fatigue syndrome. The diagnosis criteria is that they have severe fatigue lasting greater than 6 months, so that's considered chronic, not relieved by rest, and not due to any medical or psychiatric condition. And then you have to have 4 or more of these other following symptoms. Short-term memory impairment affected by lifestyle. Well, who doesn't have that? You know, we all have that. I can't remember what I did yesterday. Sore throat reoccurring. Gosh, you know, you get a sore throat all the time. Tender cervical and axillary lymph nodes. You'd be a little scared that maybe something else is going on. You have lymphoma or, you know, some other type of cancer or something else is going on. But there's no reason for that. They have muscle pain, but all the blood tests look okay, and there's no reason to suggest that there's inflammation of the muscles or anything like that. They have joint pain without swelling or redness. So their joints hurt, but when we do an exam, they don't have osteoarthritis, they don't have rheumatoid arthritis, nothing like that. Frequently they have headaches. Unrefreshing sleep. This is called non-restorative sleep, where you sleep all night long, but you get up and you never feel like you've gotten adequate sleep. And we'll talk about that here in just a little bit. And then they, like I said, post-exertional malaise following physical or mental activity, which usually lasts greater than 24 hours. So they can do, you know, very little, and they just feel like they're completely wiped out. I have that happen depending on what's going on with my family. Some days they just completely wipe me out. So the treating chronic fatigue syndrome, the treatment can be complex. There is no cure for it. There are no prescription drugs approved for it. The NIH is currently doing a lot of studies on chronic fatigue syndrome, and they've actually recently combined it with fibromyalgia to try to see if they can figure this out a little bit, because they think there's some kind of a link possibly. But so far we don't have any approved drugs that really help with this. Dr. Valenti and I did a study in fibromyalgia not too long ago, and to treat the fatigue issues of fibromyalgia, we tried a couple things. If somebody's thyroid was on the low side of normal, it was normal, but it was on the low side, we gave them thyroid to see if it helped. Didn't really help. We gave them the date rape drug, Rohypnol. Didn't help. So we tried some stuff that was kind of off-label that wasn't really out there, but you know, what do? It's very frustrating. And I will tell you, as a provider, you want to help your patient as best as you can. You want to be able to do what you can to treat them, but sometimes it's, you know, very difficult. And when we don't have answers for you, it's very frustrating for you too, because you want to feel better, but yet we don't have anything to offer. You need to continue to work with your physician closely so you can monitor your symptoms and make sure something else doesn't develop that could cause all of this. You need to deal with coping techniques, deal with anxiety, deal with stress, because all of those things will contribute to your fatigue. Activity management, live a paced lifestyle. It's very important to do that. You do short periods of activity and then you rest. You never do too much, because if you do, you're probably not going to do anything for the next day or two after that. And it does often follow a cyclical course. You have periods of illness and periods of wellness as well. So it'll get better, then it'll get worse over time. You know, I looked this up just to see if there were any experimental drugs, anything that they were really looking at. And the only thing that they came up with was focus on symptom relief, antidepressants if the patient's depressed, and then a two-pronged approach, psychological counseling, so options to work around limitations and gain control over your life, and then gentle exercise program and sending them to physical therapy to find the right types of exercise and to help them increase that activity over time so that they can tolerate that. That's what we have right now for chronic fatigue syndrome. That's it. So hopefully we'll find, you know, they don't know what causes it. We don't know what the problem is, so it's difficult to treat it if we don't know why. So next we're going to talk a little bit about fibromyalgia. It is a chronic widespread pain disorder. Fatigue is one of the most common symptoms that you see when people come in. They have unrefreshed or non-restorative sleep issues. They also have irritable bowel syndrome, chronic headaches. They have morning stiffness, which is real common in rheumatoid arthritis. So we see a lot of these patients to try to determine if they have some type of arthritis or an inflammatory condition, but they end up having fibromyalgia. They have cognitive or memory impairments. They just can't think, they can't concentrate. That's why antidepressants sometimes help a lot with these patients. They have reduced coordination and then decreased physical endurance. They just really can't do anything. So when you tell them to get out there and exercise for 30 minutes a day, they look at you like you're absolutely crazy. We do recommend warm water exercise classes a lot for these patients though, because it does seem to be beneficial, and in studies, that was one of the most beneficial things, probably as beneficial as any medication that we can prescribe out there for fibromyalgia. There is a significant overlap with fibromyalgia and chronic fatigue syndrome. It is often combined for research purposes like we talked about. There were 4 studies that showed that fibromyalgia was as disabling as rheumatoid arthritis. And $10 million from NIH is spent every year on fibromyalgia, on the National Institutes of Health, trying to figure this out. And once again, we still don't have a really good understanding. There's a lot of people that believe that fibromyalgia is a purely psychological or psychiatric condition. Until probably maybe 15 years ago, it was treated as such. And now we know that that's not true. There are increased levels of something called substance P in your body, which is a neurotransmitter. And they've actually measured that, and they know that you have heightened levels. Patients with fibromyalgia have heightened levels of substance P in the body. And then they've done those MRIs where they see that the brain reacts differently to pain than a normal person. So we know that there's something physical going on. We just don't know why it happens, and we don't really know how best to treat it. 2 to 4% of the population, and I bet it's going to go up. 5 million Americans have fibromyalgia. It's a lot more common in women than men, 8 to 10 to 1, so very common. It usually happens in middle adulthood. It can occur in adolescence and old age. I have a couple patients in their 20s in college. I actually had one patient that's at the university, and she wanted me to write a letter to her dorm leader to say that she needed to be on the first floor of the dorms because she can't climb the stairs. And she wanted me to have her tub adapted so that she didn't have to get in and out of a tub, that she would have a shower put in the dorm. And that's the kind of length that they go to because they seriously can't do normal activities during the day. People with rheumatic diseases, OA, RA, and lupus are at high risk for developing fibromyalgia. I have a lot of patients that have osteoarthritis, rheumatoid arthritis, and fibromyalgia, and they come in and they're complaining of fatigue and pain. Well, it could be any one of those things causing your problem, so we have to ask you a lot of questions, and we have to determine where your pain's at and what's going on. And a lot of that kind of stuff helps us determine what's happening. People that have rheumatoid arthritis have morning stiffness. It gets better with activity. It doesn't get worse. Osteoarthritis usually gets worse throughout the day. The more you do, the worse it gets. But rheumatoid arthritis usually improves with activity because once you get up and move those joints, it usually feels better. If you sit down for a prolonged period of time, it's like starting all over again. But after, usually less than an hour or so, you're able to get up and get going again. People with fibromyalgia have pain all the time. It doesn't seem to matter. And they have pain in muscle attachment areas, not in joints, and they don't have swollen joints. So it's, you got to kind of work through all of that. And then the blood tests that we look at also help us kind of determine what's going on. Fibromyalgia is diagnosed based on symptoms and a physical exam. And once again, there's no laboratory, radiographic, or other diagnostic tests used to diagnose fibromyalgia. We exclude all other diseases. There's still a lot of people that just believe that there is no such thing as fibromyalgia. I have several patients in my practice that their primary does not believe that they actually have fibromyalgia. We do have a couple of approved medications for fibromyalgia, however, and we've made some gains with this. Cymbalta, which is it's called an SNRI. It works on serotonin and norepinephrine, which are two neurotransmitters in your brain. These medications also can be used for depression as well. Cymbalta, I think, works very, very well. Some people have a hard time tolerating it, but I think it works well. It is an expensive drug because it's fairly new and it's, the generic is not available, but it does seem to help. Savella is another new antidepressant. It also is an SNRI. It seems to help with fibrofog a little bit when people just can't think clearly and they can't concentrate and stuff. Savella seems to help a little bit. You have to take it in a little dose pack, little starter pack when you start out. You take this one day and then you increase it to 2 pills and then 3 pills. So it's a little difficult to start, but once you get to the dose you need to take, then it's fairly easy after that. So we use Cymbalta probably more often. And then Lyrica is the other medication that's approved for fibromyalgia. This is an anti-seizure medication, and it seems to help with pain. None of these medications, maybe the antidepressants a little bit, really help with fatigue though. They help with the pain issues, but probably not a lot with the fatigue issues. And then there's other medications that we use that are kind of off-label for fibromyalgia. We use muscle relaxers, amitriptyline or Elavil we use. That's another tricyclic antidepressant, and Effexor, we use those as well. A lot of times we use amitriptyline at bedtime. Some people are on a combination of these medicines. We can use one of these and one of those and one of those if we need to. So we can use a combination of 2 or 3 different medications at times. And then these are just the serotonin uptake inhibitors, Prozac, Paxil, and Zoloft. Those probably sound kind of familiar to you. I don't think these probably work as well, but they're cheap, and sometimes it's what we use just because they're more affordable. Gabapentin or Neurontin. This drug is, I don't know if anybody's familiar with that, but it's a drug that's used for diabetic neuropathy, for people that have numbness and tingling related to diabetes, and it helps with pain issues. So we use it in fibromyalgia, we use it in chronic pain patients, people that are already on narcotics or opiates, and we use this in conjunction with other medications to treat pain. Tramadol or Ultram, and that also is a narcotic. It is a non-controlled narcotic, meaning that it's not a controlled substance by the FDA. So we use it more because we think it has less potential for addiction. Some people will disagree with that. One of the pain anesthesiologists here in town, I gave a talk on chronic pain a while back, and one of the pain anesthesiologists here in town completely disagreed with me that that drug was not addicting. And his view of addiction is whenever a patient